Today we will discuss resuscitation of newborn. Now, what is the aim of newborn resuscitation? It is to maintain adequate oxygenation and perfusion of blood throughout the body, while steps are taken to stabilize the child and establish long-term hemostasis. So, the most common indication for neonatal resuscitation is asphyxia. Most common indication is asphyxia, and second most common indication is extreme prematurity. So the components of neonatal resuscitation are TABC. T is maintenance of temperature between 36.5 to 37.5 degrees centigrade. How you maintain? By radiant warmer. Now drying the baby, remove wet linen, plastic wraps with a cap, thermal mattress, warmed humidified gas, and increase room temperature, and plus cap plus thermal mattress. So these are the methods we can maintain the temperature. So T. A is airways. Establishment of open airways by placing the neonate on his back with slight extension of neck, elevating the shoulder 3/4 or 1 inch of the mattress with the help of rolled blanket or towel. Now, suction of mouth and nose is done. So, TAB, B for breathing. Now, initiate breathing. Now, tactile stimulation is given, and when necessary, bag and mask ventilation is given, or ET tube can be used. And C for maintenance of circulation. Now, this is done by chest compression and medication. So, these are the steps TABC. So, most common indication asphyxia, second most common is extreme prematurity. Now, what are the resuscitation protocol? As soon as baby is delivered, assess the following 5 signs. 1. Term gestation, delivery between 37 and 42 weeks of pregnancy. Second, good muscle tone, flexed posture and active movement of baby. Third is active breathing or crying. Fourth is pink color. Look for tongue and lip. And fifth is clearance of meconium. So these are the 5 signs you have to watch. Now, if all signs are positive, no active resuscitation is required. If any of the 5 signs are absent, baby required resuscitation. This is important. Any of the 5 signs absent, baby required resuscitation. So the baby should be placed under the heat source, radiant warmer, and subjected to a set of intervention known as initial stage. So, what is the intervention? The first intervention is initial steps. Now, what is the initial step resuscitation? So, there are certain positioning. Number 1, positioning, suctioning, and dry, stimulate, reposition, and free flow oxygen. So, initial step 4 hota hai. Number 1, positioning of the patient. The neonate should be placed on her back or side with the neck slightly extended. Number 3, suctioning. Number 2, suctioning. The mouth and nose should be suctioned. Mouth is suctioned first. Why? Because to ensure that there is nothing of the infant to aspirate when the nose is suctioned. So mouth is suctioned first. One should not insert the catheter very deep in mouth and nose, because it is stimulation of posterior pharynx during the first minutes after can produce vagal response and causing severe bradycardia or apnea. Therefore, during oral suctioning, a suction tube is gently introduced into the baby's mouth. This is important, the landmark. So, gentle introduce of the baby's mouth until the 5 centimeter mark is at the baby's lip. तो 5 सेंटीमीटर तक बेबी लिप में आएगा सक्शन ट्यूब, तब हम लोग उसको रखेंगे, उसका ज्यादा नहीं पहुंचेंगे. बट ड्यूरिंग नाजल सक्शनिंग, a suction tube is introduced up to 3 centimeter mark into each nostril. So 5 centimeter mouth के लिए, 3 centimeter nose के लिए. This is important. 5 centimeter and 3 centimeter. So suctioning. Now dry, stimulate and reposition. After suctioning, the baby should be dried by using pre-warmer linen to prevent heat loss. Brief tactile stimulation can be given, and there should be rubbing of the back may provide in case of non-establishment of good respiratory effort. And last is the free flow oxygen. If the baby continue to be depressed, provide free flow oxygen using face mask. So these are the initial step of resuscitation. 4 होता है: positioning, suctioning, dry, stimulate and reposition, and free flow oxygen. Now, what do you mean by vigorous and non-vigorous newborn? This is also important, vigorous newborn and non-vigorous newborn. A vigorous newborn is classified under if the following three signs are present. Number one, strong respiratory effort, good muscle tone, and heart rate greater than 100. So, vigorous newborn is strong respiratory effort, good muscle tone, and heart rate greater than 100. Now, non-vigorous newborn, if any of the above three signs present, the newborn is classified as non-vigorous. ठीक है, तो दोनों हो गया, vigorous and non-vigorous. So, resuscitation, the most important, asphyxia, we just in nutshell, most important asphyxia, next is extreme prematurity. There is resuscitation protocol, and there is initial step, and difference between vigorous and non-vigorous child.
Okay.
Now, what are the other important points regarding the neonatal resuscitation protocol 2015? The new order of assessment question is the term gestation, good tone, and breathing or crying. So, golden minutes, that is 60 seconds. The golden minutes for completing initial assessment and beginning ventilation is required in the same. So, golden minutes is very important, 60 seconds to assess the every vigorous, non-vigorous, and whether the patient may be given resuscitation or not. So, delayed cord clamping for more than 30 seconds is reasonable for both term and preterm infant. So, delayed cord clamping who do not require resuscitation at birth. So, delayed cord clamping may cause that the blood flow through the placenta to the child also given. So, next is assessment of heart rate during the first minute of resuscitation. Use a 3-lead ECG machine. ECG हम लोग कर सकते हैं उसको to see the heart condition. Now, resuscitation preterm newborn, that means less than 35 weeks gestation, should be initiated with low oxygen concentration. So, if the baby is less than 35 weeks of gestation, low oxygen concentration should be given 21 to 30%. This is important. Now, routine intubation and suctioning even of non-vigorous child born through meconium stain pneumonia fluid not recommended. So, routine intubation and suction is not recommended. Now, the compression to ventilation ratio. Suppose the patient, we are given a compression. So, 3:1 compression to ventilation ratio remain unchanged. Okay? 90 compression and 30 breath per minute remain unchanged. मतलब दोनों में preterm term सब में हम लोग देते हैं 3:1 ratio. So, this is important. So, these are the important points. Golden minutes important, 3:1 ratio, and low oxygen 20 to 30% हम लोग देते हैं. So, these are resuscitation. Now we come to the point low birth weight.